So we're ready to hang our secondary bag. So the first step is to take your equipment, and then one of the pieces of equipment in the bag is your hanger. You want to make sure you drop your primary bag the full length of your hanger. So don't cross it over. You want to drop it down the full length of that hanger, and then pull out your brand new secondary tubing. So the secondary tubing out of the bag actually comes unclamped, so the roller clamp is not closed at this point, and we want to leave it that way so we can avoid that error of having a clamped secondary. So the first step we're going to do before we connect our tubing is scrub our port. So we're going to do at least 8 turns or 10 seconds. Wait our 15 seconds for it to dry. We're going to connect our secondary tubing, and we're going to back prime our tubing. In order to get this to back prime, we're going to have to loosen the cap there so that air can escape, and then allow that to back prime. And there's our fluid back priming in there. We're going to wait till our drip chamber is about 2/3 full for secondary IVs. And then once you've got all the air bubbles out of there and your chamber is 2/3 full, you're just going to use a little technique, and you can pinch the tubing with your finger and clamp that tubing once all the air is out. And then before starting to spike the bag and start programming, you're just going to pause the pump. The example that we have here today is a cefazolin, which is an admixture. So it has powder in the top of that bag there that you're going to have to mix. To mix it, you're going to have to scrunch down your bag and then grab the little plug that's inside and pull it out. So now that the plug is floating in the water there, you can mix the water with the powder until it becomes clear. You can take a look at the top of that container where the powder was to make sure that it's cleared out. Alright, so another thing to note on your bag here is the label, which is showing you that it's a 50 ml bag, but if you look in the bottom left hand corner, it's actually saying the volume of 50 plus the drug equals a total of 55 mils. So we'll need to note that for our programming. So go ahead at this point and hang your bag. And now our pump's been paused at this point, and we can go ahead and move forward with programming our pump. So again, to program your pump, you got to talk to the channel. So press the channel select, and if you note at the very bottom there's a button for secondary. Click secondary, and you're going to choose from the list of drugs here, finding cefazolin. So you can use either the page down or use your alphabet on the right hand side, clicking the range and then the actual alphabet letter there, and then choose cefazolin. The option that we had on our bag, if you paid attention to the label, was 1 gram and 50 mils. So you're going to select that option and confirm that that is correct. Press next just to confirm that the 1 gram and 50 mils is correct. At this point, you're going to make sure that your secondary is unclamped, is one of the things that the blue banner is telling you. If you wanted to change that volume to be infused to be 55 mils, you can go ahead and click the VTBI and punch in 55 mils to match what the bag says. It's going to recalculate the rate for you, and you can at this point hit start. If you note the marquee, it's going at 110, and it's scrolling across the actual drug. And if we pan up to take a look at our secondary, we want to watch that secondary for a total of 3 drops before we leave the patient's room. And there's the 3rd drop. A couple hours have passed. We're ready to hang our next antibiotic. So we've got our gentamicin there, 80 milligrams and 100 mils. And we're going to back flush our tubing that has a little bit of that cefazolin still in it, just so we can make sure that there's no issues with compatibility. We're going to back flush by dropping our tubing and allowing the chamber to fill. And once that chamber is full, we're going to invert and empty it. We're going to repeat that a total of 3 times. So I'm just going to do it 2 more times here. And once we've got that back flushed, we won't have to worry about any issues of compatibility. Since we've done that 3 times, there's just now is normal saline in that line. Completed back priming 3 times and our drip chamber's half full. Catherine is pinching the tubing here, and she's going to spike her new bag. And when she spikes her new bag, she's going to pause the pump before she hangs it. You can see she just had the tubing pinched, her roller clamp was open, and she can immediately just bring that up and hang it on the pole. So now she's going to program her pump, starting with the channel, hitting the secondary button, choosing her medication, which is gentamicin. This one's a custom drug, so she's going to have to do the blank milligrams and blank mils. She's going to confirm that's the right option. Her drug amount is 80 milligrams. Her diluent volume is 102 per her bag. She's going to hit next. Hit the duration off the bag is telling her 60 minutes, which will calculate her rate for her, and she can hit start. Roller clamp is open, and she's going to wait and watch for 3 drips in the chamber before she leaves the patient's room.